Hello everybody, my name is Desreen Shalom from Bachelor in Cardiovascular Technologies. So today I'll be presenting about the investigations supported by cardiovascular technologists and the indications for cardiac resynchronization therapy or CRT, including CRTP pacemaker and CRT-D defibrillator. So without further ado, let's get into it. So for the introduction, CRT helps patients with heart failure by improving how the heart's chambers contract together. As CVTs, we play an important role from helping with the investigation before implantation, assisting the cardiologist during the procedure, and monitoring the patient after. So knowing the investigations and indications helps ensure that only the right patient receive CRT or CRT-D, which improves the outcomes and also saves lives. So next is the investigations supported by CVT. Before a patient is considered for CRT, several investigations are done, and most of these involve the support of CVTs. So the first one is electrocardiogram, ECG. This test helps identify bundle branch blocks and QRS duration. A QRS duration of 130 milliseconds or more, especially with a left bundle branch block LBBB pattern, indicates the ventricles are not contracting together, which makes the patient a possible candidate for CRT. And then the second one is echocardiography. It measures the left ventricular ejection fraction, LVEF, which shows how well the left ventricle pumps blood. If the LVEF is 35% or lower, it means the heart is weak and may benefit from CRT. Echocardiography also helps us assess mechanical desynchrony, which means delayed contraction between the chambers. And then the third one we have is chest X-ray. This helps check the heart size and the placement of any previous leads or pacing devices. The fourth is device interrogation, which is done for upgrade cases. It examines the pacemaker or ICD's previous pacing data, checking the lead function and battery life. And then lastly, we have the blood tests. With these are important to assess the patient's readiness for the procedure. We usually check for electrolyte levels such as potassium and magnesium because imbalance can cause arrhythmias. And then we also do renal function tests like urea and creatine to ensure the kidneys can handle the medications and contrast agents are used. And then we have cardiac biomarkers such as BNP or NT-proBNP to assess the severity of heart failure. So all these tests together help confirm if the patient truly meets the criteria for CRT and is fit for the implantation. So next is the criteria for CRTP pacemaker. So according to an article that I have searched, CRTP is recommended when patients meet the following criteria, I've added in the slides. So they are in one of the criteria is that they are in NYHA class 2 to 4 heart failure and still have symptoms even with optimal medical therapy. And then the second one is LVEF is less than 35%, which means poor heart pumping function. And then the third one we have is QRS duration is 130 to 150 milliseconds or more in sinus rhythm, ideally with a left bundle branch block pattern. And then for the fourth one, they have normal atrioventricular conduction. And if there's no risk of arrhythmia, ICD is not required. So in short, CRT-P focuses mainly on pacing therapy to synchronize the heart's chambers and improve contraction efficiently without providing shocks. So next is the criteria for CRT-ICD, CRT defibrillator, CRT-D. So CRT-D includes all the requirements of CRT-P plus additional criteria related to arrhythmia risk. It is indicated in patients who have a high chance of sudden cardiac death or ventricular arrhythmia, and then a past history of secondary prevention cases such as ventricular tachycardia (VT) or ventricular fibrillation (VF), and the need for combined defibrillation and pacing function, which allows both shock therapy and resynchronization. So in other words, CRT-D provides pacing just like CRT-P, but it can also detect and deliver an electric shock automatically if a life-threatening arrhythmia occurs. So CRT-P helps with coordination, while CRT-D helps with both coordination and life-saving shock therapy. So now let's look at the role of cardiovascular technologists or CVT in supporting CRT investigations and the implantation process. So before the procedure, we perform echocardiography and ECG to confirm the patient's condition and make sure they meet the indications for CRT or CRT-D. Next, we prepare and examine all implantation equipment. This includes checking the leads, pacing system analyzer, and ensuring all sterile instruments are ready for use. So during the procedure, we also assist the cardiologist in inserting the CRT-P pacemaker or CRT-D device. We also help position the leads correctly in the right atrium, right ventricle, and coronary sinus for the left ventricle. So throughout and after the implantation, we continuously monitor the ECG readings and pacing thresholds to make sure the device is functioning properly and that there are no rhythm disturbances. So finally, after the procedure, we educate and inform the patient about post-procedure care, or the doctor will do that also, such as attending follow-up visits, avoiding exposure to strong magnetic fields, and reporting any unusual symptoms. This is for the safety for the patients. So then, in short, the CVT's role is crucial at every stage, from pre-assessment and post-care, ensuring the safety, accuracy, and also the success for CRT procedure. So finally, as a conclusion, cardiac resynchronization therapy or CRT improves the efficiency of the heart's chambers pumping in synchrony, particularly in patients with weak heart muscles. And also, as a CVTs, it is our responsibility to assess patients and conduct the tests that inform therapy choices, whether it's CRT-P or CRT-D. And then depending on the severity of the heart failure and the possibility of serious arrhythmias, a CRT pacemaker or CRT-D defibrillator may be recommended. And finally, our support as CVTs during investigations and implantation is very essential in ensuring patient safety and successful outcomes. So that's all from me. Hope you all understand from my presentation and learn more about this topic about CRT devices. So thank you.